Hi everyone. Thank you for joining us. I'm Dr. Anita Kumari. I'm a hematologist oncologist at Valley Medical Center and also a medical director at AIM Specialty Health. Here's a bunch of really amazing citizens who have done a remarkable job just joining each other and working to help the healthcare providers, doctor, physician, and everyone basically. I want you guys all to join in this whole series. I'm gonna just mute everybody. Okay. Just to in this during this pandemic, the COVID-19 pandemic, it's so easy for us to just think about the disease, the dying people, everything else happening, but sometimes it's also important to focus on the hope and the help that we are getting. In these last few days, with what all we have seen, I want to focus and I want to dedicate this time to acknowledge all the good work that most of us have done. I do want to just say a few more things. So California, as we all know, is bringing hope to the rest of the country. That's amazing news. Every hospital is giving us something good every day. We are going down in our numbers of, I think, deaths, ICU beds, and please correct me guys if I'm wrong, but it looks like everywhere it's good, situations are coming good. Patients are getting discharged, patients are practicing social distancing, so we are doing much better. So I want to start this hope series to acknowledge all the community efforts to help the physicians and healthcare workers, and please join hands to applaud these selfless citizens who continue to relentlessly work and help the community fight the pandemic. I'm going to just take all the names and I'm going to unmute everybody. Okay. Okay, there you go. Now you guys can clap.
There you go.
Thank you so much, everybody. So I'm going to just take the names. Shaiza Ali. Shaiza is one of my very good friends, a Bollywood instructor and a marketing, Shaiza marketing
Professional. Yeah, in the high-tech industry.
as well as very active citizen in terms of, I've seen her getting together so many community challenges, community groupings, and she has been a remarkable person helping us with procuring protective equipments, getting vendors. I don't know how she has done it. So we have Shaiza here. I will I take Krupa Karwal. Krupa is, hi Krupa, you want to just say a few words about yourself?
Sure, yes. I guess I also come from the healthcare industry. Started out as an occupational therapist, worked in many different hospitals, went back and did my human factors and ergonomics degree. So I'm a consultant with many hospitals right now, mostly just Stanford Health and all their clinics. And partly just the motivation was just try to help wherever needed, because I know how difficult it is in the healthcare world. And whatever little we can do, I think people, were just very overwhelmed and had to do something to help. And I think when we started building things, there was just no question. People just started pouring in to help without any need of anything. They started buying equipment, they started building, and more people, even today, I have 4 or 5 more people that are calling me and saying, how can we help? How can we help? So it's a great way to see how wonderful our community has really just come together. It's just amazing to see.
And then, so I think Krupa and Shai, they have worked together in, at least in the volunteer work that I know of. Shai, would you want to give us a little bit of what exactly Krupa and you have together come up with, and how you have guys been doing what you're doing for us?
Yeah, so I really should let Krupa talk to this. She's leading the initiative. Krupa had this wonderful idea to make face shields. And there was a couple of instructional videos out there, what materials we could procure to make those. And she started asking around all her friend groups. Krupa, I'll let you talk to that. But how I got involved is purely as a volunteer. And I knew whatever Krupa is heading would be a good thing. So I joined in and procured those materials. I used the videos, Krupa, that you all had. But interestingly, as I was making these, I was sending pictures back home to my family. I have family in Australia, London, India, and Dubai. So these are my siblings and in-laws. So I was sending them pictures, and they all wanted to do that for their communities.
Yes.
So I made a little instructional video, took some pictures, and sent it on. And so, Krupa, your efforts have really traveled across the ocean. So then now they started sending me pictures of what they were making. So bottom line, really, we are living in an unprecedented crisis. Hopefully in our lifetime we won't see anything like this. And most of the war is really being waged by you healthcare professionals in the front lines. And other citizens, in some ways, we know the most we can contribute is stay home, and keep our family home and stay positive. We all do want to contribute, but everybody is looking for ways. What are some ways that we can make an impact? I thought about the skill set that I had, and how can I contribute and make an impact? And Krupa, that's how I got involved with your initiative. Anita, that's how I got involved with your initiative. And, like all other volunteer work, you always get back way more than what you put in. So, over the last couple of weeks, yes, it's been a lot of work, but it's been very gratifying work. And I made a lot of new friends in this process whom I can't wait to meet when all this is over and we go back to life as we knew before. The satisfaction that we are in small little ways we are making impact. And also it has a ripple effect, right? Krupa, you started something, I joined, the ripple effect goes across, literally went across the ocean. And all that is very gratifying to see. So all medical health professionals, you all are the true heroes. We are just happy to be able to contribute in small ways to kind of help you all, so that you all don't feel like you're doing this all alone.
So thank you so much. Krupa, you want to add? And I will ask more questions. Go ahead.
Yeah, no, just, I guess for me, it was one of the doctors at Kaiser Santa Clara, two doctors, Dr. Matosh and Dr. Razia. They actually had no choice but to start developing the face shields. They ran out within a week. Wow. of this being announced and happening. They had nothing. And so as they started making it for themselves, they developed a video so they could help other people understand what they did. And once a group of us got a hold of the video, we just ran with it. It was just like, oh, no question at all. Let's get the equipment. Let's start buying with whatever money we have. And people who just volunteered everything, their own money, their own resources in whatever way they could. And Nipurna Shah, she was one of the initial friends. She's a friend of the doctors. So it was really great I knew her. And so once I jumped on, I just brought in everybody I knew, and it wasn't very difficult to really get that help. So that is how it all started.
So I'm going to ask you questions, because I know in this pandemic, when people are getting sick, it's not easy to dedicate your time for something that you are not going to use. Like right now, we are just learning our house, everything from ABC, cooking everything together by yourself, managing houses, kids are at home, taking care of kids, and people are getting sick, right? I know Shai called me one day, her daughter was sick, and still she was so dedicated. She was so much into the volunteer. How did you guys manage to be like, be there? Like I have had so many of my friends who are actually having trouble managing everything. Even like for me, I am still struggling with so many things. How did you guys do it? It's a lot of motivation. It's like for somebody, we are in this. We are like, we as healthcare professionals, we are completely drowned in it. We cannot come out of it. What about you guys? You guys just should have, okay, fine, what motivated you to do it?
I actually included my whole family. That's how we all kind of learned from it. We all watched the videos together. I have 3 kids, 19, 16, and 13. My husband was on board. He started researching. He thought of easier ways. So he actually improved the design. I should give him some credit for that. He improved the design, made it easier for us. So we didn't need the glue gun. We didn't need the full, he just got something that was already the glue added stripping that attached to the visor part. But we just got into action. And soon as we got the equipment in, within 2 hours, the 5 of us made 100 face shields. And it was just a motivating factor just because everybody in the family was involved. And I think, and it was a team effort because they knew if mom was going to be busy here, they have to help with the dishes, the cleaning, the laundry. So that was motivation for me to keep going because they had to do all the other stuff.
How can I ask you, Krupa, together, how many have you made so far, the face shields? Because I know you guys have given us 200 already. And that's just
Yes.
to us. How many have you made so far in the last?
Oh my gosh, we have a spreadsheet
Okay.
that is rather long, but you know what? We're at this place now where we can't even keep up with the spreadsheet. We're just rolling in with so many face sheets. So like I said, I brought in 2 friends, one in Fremont, one in San Ramon. My San Ramon friend brought in another 5 or 6 of her friends. My friend in Fremont brought in 7 of her friends. And I have quite a few people in South Bay where I live as well. So that just spread. And we have a WhatsApp group right now. So I can't keep up with the numbers, but I just got another one from today saying, I made 50, who needs it? I'll make 100 by Sunday, who needs it? I'm making another 100 by this weekend, as I just ordered.
Krupa, in 2 weeks, approximate 5,000?
Oh, yeah.
Wow.
I would, well, maybe not 5,000. Let's say 2 to 3,000.
Wow.
Yeah, approximate.
And thank you so much. That's really very, very important. Actually, we are using it. Nidhi will be able to tell you it has already reached most of the physicians. So we really appreciate all the help you have given.
And these are reusable?
They are reusable, right? Krupa,
Yes.
they are reusable for one.
And I just want to point out, because I've been talking to at least Shai, I think the obtaining the materials has been a struggle too, and you guys have been really creative in kind of resourcing the material. Isn't that right?
Yeah, so that was interesting. So Krupa, when initially the document came, it had some recommendations, right, on what materials we could use to make it based on the video by those 2 doctors. So I made a wish list on Amazon. Krupa, you saw that, so that all volunteers could go to the same wish list and start ordering. But even as I'm working, I'm ordering, things are running out. Supplies are running out, and I presume Amazon uses AI because they started detecting the surge in demand in all these materials, and the prices started going up. So then we started looking at alternate retailers like Walmart and Home Depot, and Krupa, I saw a bunch of others, right? The people people posting, and even the material itself. We had to get creative, and I could see lots of suggestions coming in Krupa's group as to what people were using. Yes. So yeah, just getting the materials, what was available like a day before, we could see it change day by day. And Nidhi, I saw that as we were working with the vendors too, right?
Yeah.
Such a dynamic environment, right from regulations changing to 50% of masks. Sorry, I'm digressing a little bit from face shields, but the other protective equipment that are there that these medical professionals use, about 50% of the supply comes from China. And, what happens in a time like this, when there is so much demand and so much uncertainty, is that there are a lot of scam artists, con artists. We have to filter through all that in a very dynamic environment, I have to say. So some things, we had to make decisions on the fly as we were, based on the information that we had.
I'm going to ask you a few more questions, Shai, because yes, you just mentioned the next part of the volunteer work that you led for the protective equipment for all the physicians. And Shai actually led with Nidhi and Kavi. And I have no clue how they did that. They actually found really the best vendors. And we have 1,595 masks that are on their way for the physicians. It's all voluntary.
Fingers crossed.
Fingers crossed.
Fingers crossed it makes
amazing work. So, and I know Shai has been going through so many other, volunteer works, but she kept this at the top. Within 5 days, we had everything online. We had the money. So, Shai, what was your motivation? I'm going to ask you this because I have no clue. Go ahead.
My motivation is I'm surrounded by inspiring people. I am in awe of your entire team. I think I came in really wanting to help, but you all had it. I couldn't believe it. Here were a bunch of doctors. We had all plunged ourselves into a world which we knew nothing about, right? We are trying to procure gear. We are talking to vendors. I'm learning specs of, things that you all use. I'm trying to have an intelligent conversation with the vendor and not letting the vendor know I really have no clue what I'm talking about, but I wanted to do the best job that I could here. Really, and Nidhi, Kavi, Anita, your entire team, really, so dedicated. And, all I know is you guys were inspiring me. I wanted to do my bit. And I was so in awe of what you all had accomplished. I wanted to contribute to that. We could break down the problem, it's admirable that you all decided not to wait because you all didn't have the gear. You all were fighting a war in the front lines without the gear, and not only you all are putting yourself at risk, your families back home at risk. So I couldn't even imagine how we obsess over the health of our family back here, even just staying home, and you all had to be out there with nothing to protect you all. So that itself was motivation. And when I came, you all did have a structure, and we built the structure together. We tried. There was a lot of chaos. There was a lot of uncertainty, but we tried to build a structure on here's the problem. This is how we are going to solve it. Here are some vendors that we could possibly source from, but we need to vet these vendors. What are the factors we'll take into consideration? We made our own chart as to, these are the things. And there was no easy flow chart for us to make a decision, right, whom we should go with. So it was really a method of triangulation, trying to assess their credibility, trying to assess the specs of the products that they could provide, what is the delivery date, trying to keep abreast of all the regulations that were changing in the meanwhile. So a lot of factors there, but I think the team, it's ultimately at the end of the day, it's what people can accomplish when they come together. You don't need to know you don't need to know everything, but when you come together, there's a process of discovery, and then there's a process of achieving the goals that we set out for. So yes, I learned a lot, and so happy to work shoulder to shoulder with this amazing team. Anita, I hope that answered some of your question. I'm all over the place.
No, you're actually very true. It is, it's so important to get together, and there was never a day that we shied away from whatever work it needed. That's amazing. Every day we were having meeting for 2 hours at times. So, you guys did amazing, I must say. I will move, shift gears to a little bit to, let's talk to Dr. Gaurav Malhotra. Can we have you? So I actually virtually met Dr. Gaurav Malhotra trying to find more N95 masks. And here I came to know, I actually did a video chat with him, and I saw his home converted into a kind of a factory, something like that. Please, would you explain to me exactly what do you do, Dr. Gaurav Malhotra? Go ahead. I want to know exactly everything.
It's my office, what I showed you. And, I think all of you are doing a great job, not focusing on the problem, but focusing on the solution. And obviously the problems is here to stay, which means work will continue to get done. And right in the beginning, when I had seen the problem, I had felt that the first thing I need to do is protect my set of patients. So we have about 2,000 patients in our practice, and we deal only with seniors. So that makes it really, really difficult for us that if we don't protect them, we take a huge financial hit. So my desperation was that I have to get the masks and get them to my patients. And in that desperation, I started looking for N95s. And I went to every little store out here, whether it was a Home Depot, Lowe's, a tractor company, a farming company, a painting supply store. I didn't care what it was. And I picked up all the N95. I didn't care what people looked at. They looked at me a little weird to begin with. And then when I had settled for all these, I had about 500 masks. So
Okay.
that was my little nest egg. Then I realized that these are not going to be enough, because when we spread the word to our patients that we're going to give you one N95, but you'll have to pay $5 for it, we started seeing a huge demand for it. So as the demand started to increase, I started hunting and I couldn't find them. I said, this is it. Until I struck gold in one store and I asked for, they sell boxes of 20. So I ordered 200 boxes. That would have made me have about 4,000 masks. So it would be enough for my family, my office, patients, and a few friends. We realized that the patients don't want as many. The initial surge was there, and then they all fizzled out, because those who were concerned to begin with, and they've remained concerned, and those who are not concerned, or maybe it came too late. And then when I saw that physicians all over the country didn't have them, but I had my own little supply, I started posting on Facebook that, guys, I'm going to give you a free N95. You need to pay me postage. That's all. So,
how many people, how many physicians did reach you? Because I know one of them was me. And I tried to convince Dr. Gaurav for every physician that I know. I'm like, I have a group of 100.
one per doctor. That's it. Just don't ask me for more. So I had people come up and ask me for 100. When I looked up their group, they had 9 physicians. So I said, I can't do this. You know, every doctor is just as important as one of you.
I agree.
So, and these guys are all on the front line, and most of the physicians, it is so surprising, ask me just for one.
Yeah.
I just want one. My husband is a doctor. I'm a doctor. Can you pass us 2? No problems. So I started sending, and I think I might have sent about maybe around 1,000 masks so far.
Wow.
So I also noticed that the local police guys didn't have any. So I supplied them with the masks. The local fire department, the first responders, didn't have any. So I supplied them with the masks. State troopers didn't have any. So they got the masks.
Wow.
Intensive care units didn't have. So I supplied them with the masks. Nursing homes, assisted living facilities. So my little nest egg has hopefully made an impact over here.
Wow.
Then we had some free drives for healthcare workers. So my office staff and we got together, we turned on the music, and we had drive-through mask supply to every health worker who turned up.
That is such an interesting concept. I just heard that from you and I was like, wow, that is amazing. That is.
It was really nice. You know, we were all dancing through the whole thing. We had gear to protect us, and then we would teach them how to use the N95, and then they would go off. And trust me, people gave us donations for one mask as much as $100. Say, here, I really appreciate what you're doing. So, and people coming in ordinary, vehicles. It was nothing fancy, but $100 out of their pocket for doing what we were doing. And people started sending us money from the community. It's, I don't think I'll lose a penny on this. I think just early action is what made a difference. Like you guys have early action in California. You guys have made such a big difference and impact. And for me, I've enjoyed the whole attention. Okay. It's been such a fun ride. So doctors now write to me that where do I send the postage to? And I just tell them, don't pay me a thing. Just help another doctor sometime when you get a chance. And some people say, no, I will still send you the postage and I will help the other doctor as well.
How nice, how nice. Yeah, I remember you didn't ask us for the postage money, so I was happy about that. Okay, never mind. Nice. Yes.
You know, it's
That's not gonna work.
this
That's
is
okay.
for all of us
Yeah,
as
I'm
physicians
making
and some of
dinner.
us doing well in our lives.
So
This is,
maybe not.
but hopefully we'll continue to do this. I've done a lot of research on how to make the N95s. I've shared some with you.
Yes.
If you look at the research from the University of Florida Anesthesia Department, it really is a big deal because that'll be a game changer for us as the price of N95s climbs up.
Hmm.
To get it directly from China, you cannot get it below $3 a piece now. And that too, if you order 100,000 masks. So I've been trying to negotiate this with the guys in China. They give me 100,000. Yesterday, the guy said after April 10th, which is today, the price goes up to $2.85 without the shipping charges. Shipping charges are 40 to 50 cents from this particular vendor. So, you know, you start noticing that the trends are early action, early action. So whatever you can do right now, do it. If you can find alternatives, I would suggest that move on them, just try them out. Like you've made the shields, you know, just early action. We don't care what the vendor does. We're going to do it ourselves.
Yep.
Same thing. If you guys like, I'll share with that article with you what the University of Florida doctor has discovered, and it's been tested by their virology lab. So it might help us all out.
And what would be the cost of that N95 mask if we make it?
Without labor, or you
No.
want to get it made in China?
Sorry.
Get made in China.
So,
Without labor over here, it'll be about $1.50.
wow. Okay. So that's our next project.
But the best
That's
thing
the
is these are
Halyard.
100% reusable.
That's the
They're made
Halyard
of
fabric, right? That you're talking to.
100% reusable. You can wash it, put it in the washing machine.
Wow.
So
Interesting.
that'll be a game changer.
Yes, I agree. So that's the next project probably Dr. Gaurav Malhotra is gonna start, and I think we that's a good way, because I think we are still lacking N95, at least in California in some hospitals, what I have heard. But hoping next week it would be a different day, and probably with the 200 million masks every month, Governor Newsom has projected, we should be good. I will thank you so much, Dr. Gaurav Malhotra. I will ask Dr. Shamli Singhal to add. Dr. Shamli Singhal is very active in the community as well, and she's a surgery oncology director of El Camino Hospital, and she has a very innovative idea that I wanted to share. And go ahead, Dr. Shamli Singhal. Go ahead and
Thank you.
let us.
Thanks, Anita.
Yeah.
That's so kind of you. I actually have two projects to talk about. The first one has to do with masks. So I'm a surgeon, and most of my surgery is elective, so I'm sitting at home. And so I was on Nextdoor, and a couple of my neighbors wanted to sew masks. So we talked about what kind of masks. I tried them all on. I tried them on over N95. I did all of these things. But then an article came out about that Halyard fabric. And it turns out in the operating room, what you do is when the sterile box comes with the with the equipment, it's packed. It has a sterile container around it, which is that Halyard material.
Interesting.
And so then I got the OR nurses to give us the ones that they were doing for the emergency cases. So they're giving us all the fabric. And so every day I went to pick it up, and every day I dropped it off at my neighbor's house, who's been coordinating this whole effort. And it's been wonderful. There's 88 people that are sewing masks out of this fabric. They've made 600 masks out of that fabric, and then they made a zillion other of these other masks. The thing that's been very neat is that the OR nurses are getting that fabric. They're delivering it to these ladies and gentlemen to sew that are in our neighborhood. And then they're going back to the anesthesiologists. They're going back to the frontline workers and things like that, so they can preserve the use of their N95. So that's pretty cool, right? So that's one topic to keep in the theme of what you're doing here. And then I'll tell you about my second project. So my second project, I've been working on this project for almost 2 years, okay? And it's a platform. It's called Apricity Health. And what Apricity Health does is it takes patient-reported outcomes, and it takes patient-reported outcomes on a particular disease. And we started in oncology, okay? So, because that's my specialty. And we were looking at patients that had cancers for which they were getting those new immuno-oncology agents, Keytruda, Yervoy, et cetera. we rolled those drugs out because they were so good for patients. We didn't really know all the side effects for which these patients are to have, and the side effects come on pretty quickly, and some of them can be lethal. So what we instituted was a system in which the patients would do, because their appointments are every 3 weeks, right? Not every patient is going to call in. Not every patient is going to know that this diarrhea that they have is different than every other diarrhea. And so what we have is this check-in system. And so the patients check in every day for oncology, it's a specific list of symptoms that relate to their side effects. Then the nurse on the back end checks their symptoms. And so they check all of this, and then they get a score. They get a red, green, yellow. So if you're green, good, have a great day, check in tomorrow. If it's yellow, then the nurse calls you back. And then if it's red, that means the nurse will call you back soon, and you might end up with a visit with the doctor. Okay. And so and then on the back end, it's a lot of AI, it's a lot of machine learning and best practices. There's a SOAP note that gets created. It gets back into your EMR. You can order labs. You can get all this data kind of on the back end. All right. So this is the platform. So then here we are running this trial in oncology, and COVID comes around. So we added apricity as applied to oncology is one thing, but apricity as applied to COVID is a whole nother thing. And so we did a beta test here in the Bay Area with my sewing group. And so what they do, and I'll show you a little video of what the app looks like and how it goes. But essentially what it is that you put in your information, you give your health information in there, then you put your exposure history. Like, was I around somebody with COVID? Is somebody in my family sick? Whatever the information is. And then you check your temperature. You put your temperature into the app, and the app will give you a red, green, yellow, and actually there's an orange in there now, but there's red, yellow, orange, and red and green. So it will tell you tell you that, and the nurse, and we have triage nurses that will call you back based on your symptoms. And so my husband did it today, and he said that he was having chest pain. So the nurse calls back within 10 minutes.
Wow.
I don't know why he thought he was having chest pain and didn't tell me, but he told the nurse, told the app. But anyway, and after the nurse visit talks to the patient, then if there's an issue, they'll go to the physician, right? And so we have physicians that back up these nurses, and the physicians then do a televisit with the patient. Every patient that signs up for this will get a complimentary RN visit to answer any questions, to assess their risk, and actually to do the thing that's really important. And for the physicians that are on, that sometimes patients tell you things and you need to verify them. So that nurse check-in really helps you to verify what's actually happening here. So Anita, I'm going to share my screen.
Sure.
Maybe I'll share my screen. Okay, I'm going to try to share my screen. How's that? Okay, and then
let me enlarge it.
Okay. I think I'm trying to get my screen shared. Maybe. Oh, here it goes. Okay.
There you go. We can see it. Yeah.
Okay. So here's the little video. All right. So you log in and type in your email, type in your password. And so this is just a screen filming of this whole process. And type in your mobile so the nurse can get a hold of you. And so it goes through a series of these questions. And the first set of questions is a little bit longer. Maybe it takes you a couple minutes to do that thing. Okay. So there's a privacy policy, and as of now, everything's free. So, it's a privacy policy, and it connects on the back end to your physician. So we can send information back to your primary care providers.
But is it for oncologists mainly?
No, it's for everybody. The COVID application is for everybody. So for example, in your practice, if you wanted to offer it to patients, we could certainly talk about it, because they'll give you a series of questions, and it helps with reassurance to patients that are not sick, helps the patients that need to stay home even if they are sick connected. And then if you are sick, you get to see a doctor who does COVID all day long, right? That's all they do. So they can order labs for you, they can triage you, they can see you on video to see whether you're good, you're bad, and then make a recommendation. And then there's follow-up if you need follow-up. So here you go. Here's the 7-day check-in. And then a little bit of travel history. And how bad was your cough, etc. And then you type in your temperature. And every day you check in. So the app will then send, so here your status is orange, and probably the nurse will call you at orange.
That's very interesting.
Right? And then you get a report, you can send that report on, you get an appointment, you can get a televisit. So it's all that. Let me unshare my screen here.
Spiritual burdens. Lord,
Yeah.
the spiritual burdens.
You know what you're doing.
Oh, no, the YouTube just.
I can stop sharing. Okay.
Yeah, stop sharing. Thank you.
Yeah, no problem. This is very interesting. I think that's something that is needed right now, because I think even getting the telehealth right now is very challenging. I have had so many patients, actually so many people who reached out to me that they don't have a primary care. And right now, in this situation, finding a primary care, and if somebody's just moved from one city to other, these are some situations where we can actually use this app. Very interesting. Thank you so much, Dr. Singhal. Is there any questions?
App?
So Anita, this is available to you today. So if you want to check in, you want to do it, you can download the. So it's on. So I socialized it on Facebook and Nextdoor, but I can certainly send you the link.
Yes.
And so if you want the link, and I have some one-pagers on how to check in, how to do these things, and then you're welcome to socialize. It's live.
Perfect. And it is free of cost right now.
Free of charge.
Very good. Okay. It's very nicely done. Thank you so much, Dr. Singhal. I think this is really needed at this point of time, especially because of the changing scenario. Thank you. I will now move to Dr. Nidhi Gupta. Nidhi, do you have a question?
I was just asking, is this an app, or do you need a software for this, or you can use it on phone?
So you could use it at home. So it's a mobile and desktop ready. And so what you do is you just click the link that we send you, and it goes right to the registration, and it's a browser-based.
So as a provider, if I want to, send it to my patients.
Right. We can have you send. We can just.
I see. Information come to me.
On the provider side, there's two ways to do it. We have a doctor, right, that is taking all these calls. But if you want to take the calls, we can send the calls back to you, right? And if you want your nurse to do the triage, we can work that out. Right now, we've hired nurses to do the triage, thinking that the nurses, that people in your office don't necessarily have all that time to be able to do that. But we're flexible. We want you to use it. Right, we don't have any strong feelings about whether you use our system or your own.
Right.
How are you financially viable with so much staff and not getting any revenue out of it yet?
Well, right now we're doing it as a demonstration project. We probably will need funding within a month or two, but right now this is the crisis. We're just going to deal with it and roll out the platform and worry about where the money's going to come from later. Maybe that's not a viable solution, but that's our solution.
This is very interesting. Thank you so much.
Sure.
It looks like the need for the time right now. So, yeah. So I'm gonna ask Dr. Nidhi Gupta, who's actually one of the most active physician members we have. So Dr. Nidhi Gupta and Dr. Kavita Jayachandran, who's not here, she's actually rounding in her hospital. They have actually created a GoFundMe page. They have a donation site. They have, Nidhi, please go ahead, take it and tell me what all you have been doing for all the physician friends we have and everybody. Please go ahead.
Well, it's not new to you, Anita, because it was instigated by you. You were very much one of the founders of this GoFundMe campaign. So thanks to you, first of all.
Yeah, I thought about it, and after that I had to leave it because of my and Harsh's, my partner's health conditions. But now it's all your baby. So go ahead, baby. Let's hear it.
I wouldn't call it my baby. I think it's a community effort. I mean, we have Shai, Krupa, we have non-physicians and physicians. What it is for those of the audience who don't know is, you know, being a physician, you know, and I'm speaking for myself, but I think I echo the sentiment of all the physicians who are out there, whether inpatient or outpatient. You know, we're just trained professionally to just go in, see the patient, do what's needed for the patient, come back home, right? That's day in and day out what we do. And then with this pandemic, we were facing this very unique scenario. For the first time in my career, you felt vulnerable. You know, all the physicians are out there wanting to care for the patient, and the only barrier in doing that was lack of adequate PPE. And it was for several reasons. You know, you could be an asymptomatic carrier, you could give the disease to others, you yourself can be quarantined if you bring the infection, you know, home, you have parents. So a lot of anxiety, fear, vulnerability was going around, and all the physicians were talking about it, especially in our local area. We all wanted to do something. You know, this was really out of our, you know, realm of practicing medicine, you know, going outside of medicine and doing something for ourselves. We've never done this. And Anita started a group, and she said, all right, let's bring everyone who wants to help, and let's do something. We did not know how we're going to do it. We just knew we want to buy PPE, so we need money. So we started a GoFundMe campaign. We're like, the first thing is let's just get the money, and then we'll figure out how to buy and what to buy and where to buy. And trust me, we had no clue. We really had no clue. Well, 2 weeks, I am so proud of the entire team, and a couple of us are here. Shaija is here, and Krupa is here, and Kavi is still working, but Smriti, Meenu, I want to take everyone's name. Lata, who else am I missing? Gautami, and then we have Deepti and so many other people. So it's 2 weeks. The funds came in, then we scrambled. All right, let's buy PPE, and that's when we realized there's no vendor. Like Dr. Mehrotra was saying, there is no vendor out there. And plus, we're not buying millions, we're buying thousands just to help our colleagues, and nobody wants to sell 1,000.
They don't have it.
All these vendors, and we're like, what are your specifications? You know, as a physician, I always ask my nurse, give me an N95, I'm fitted for small. I never looked into what was the number on it, whether it was FDA certified, you know, nothing. And then Shaija asked me, all right, we have an N95, shall I buy it? I'm like, oh really, where did you find it? And then we're like, okay, let's go back, let's learn what are the specifications of the N95. And so we had a whole team. We pulled in some infectious disease doctors and pulmonologists and intensivists. A lot of education went in, a new kind of education.
Nice.
We know a lot about N95s now.
N95s also?
KN95s. We know all kinds. We know CE certification, European certification, FDA certification.
Yes.
We educated Shai in the
We also looked at your Halyard H600 fabric. We looked at that video too. But we decided we want to go for the best for our physicians, which is N95. We're just sticking.
You know, I think with the fabric, you can't gain a seal. That's the biggest problem.
Yeah. Yeah.
So we definitely need to work on that. I don't know. Are you doing something about that, Shamli?
What we're doing is we're reusing the N95s for non-critical patients. So if you're not doing a bronchoscopy, you're not intubating, you're not, obviously with someone actively coughing, we're using a cover on the N95 mask. So either a cloth or the halyard, whichever it is. But the trouble is those masks are so hot. To put one mask on is one thing, to put two masks on is yet another thing.
Yes.
So then you're constantly moving your mask open so that you can feel like you can breathe, and then that sort of defeats the purpose of the thing.
True.
But it's what it is.
And then not to forget the face shields, right?
Right.
Yeah.
I'm a surgeon and I'm used to wearing a mask all the time, right? I mean, I wear masks for lots of things, but the N95 to me feels very claustrophobic.
To a lot of physicians, yeah, because it's a tight seal.
I tried a PAPR, and a PAPR is cool because
Yeah.
it's
Positive.
flowing the air through you all the time. So it's really nice. Temperature-wise, it's probably the most comfortable thing. And of course, the protective factor is 20 times higher than an N95.
But you can't walk around doing rounds with it.
They won't let you. That's the problem.
They won't last.
They won't let you.
They won't let you.
Yes.
Maybe that should be in our next project, Anita, buying PAPRs.
No, we are on ventilators.
Hopefully we don't need. Hopefully we're flattening the curve and keep it down and keep the social distancing. But just to finish my thought, in 2 weeks we've almost reached our target, 2,000 short of our target about. We've used more than half of our funds and placed orders. We've received our initial shipment. We started distribution yesterday. Some of our physicians have received the N95, the face shields, and the caps. We are in the process of placing the next set of orders. So really, really excited. It was a big struggle. It was a community effort from physicians, non-physicians who were still working, homeschooling kids, but still working every night, early morning, texting like, okay, let's get this vendor in, let's place the order. And looking at the specs of each N95. So it's been a very, very rewarding experience when you can finally call your physician friend and say, hey, I got the mask for you, come on and pick it up. So it's.
Do you mind sharing the price that your purchase point at this time?
That's an insider secret, but we have we have a different price range going from $4 to, we've gotten quotes all the way up to shy, 7 or 8?
Okay.
Yeah.
Yes. Dr. Gaurav, what we ran into is because our quantity is low, right? And these vendors are used to dealing with a certain minimum order. So we kind of lose some.
You want 1 million? I said, no, I don't want 1 million.
Yeah, everybody's ready to sell 1 million, but 1,000 is absolute no. Like, oh my God.
So then we are appealing to their sense of compassion to kind of negotiate with us. So.
And the other problem is the reliability is such a big issue these days, asking them for the FDA certification and really knowing. So what we would try to do is just keep our orders with local vendors who somebody in our chain of contact knows and has ordered for someone before that we know of, so we can get a reliable product, because the ultimate goal is to provide adequate protection. And then the third thing is how quickly can they deliver? I mean, if they're talking, a month from now, that really defeats the purpose.
Right.
So yeah, those are the three things we've kept in mind when we're scouting our vendors.
So you guys any PAPRs at all or none?
We didn't look into those.
We didn't. Yes.
I think what we're helping out is physicians at the front line mainly, and also like nursing homes or private physicians or ER physicians, hospitalists, because we're assuming, or we're hoping at least, when you're doing the high-risk procedures, you're getting the PAPR. You're getting a full PPE. I mean, that is a must when you're doing those procedures. It's the other ones that are being rationed for PPE, right? So we really want to cover those people. So that's why PAPRs is not on our list. It doesn't.
Not yet.
Yeah, not yet.
I'm going to ask one more question because for me, so Nidhi just asked me one question a few days back. What if one of your colleagues dies tomorrow because they couldn't get an N95 mask. And that changed my life. That question 2 weeks back just made me realize, is a N95 mask of $5 worth any of my colleagues' life? That was it for me. That's where we never looked back to, even think before uh, going forward, whatever time, whatever minutes, whatever hours it took. Nidhi, what was your motivation? I'm going to ask you that question because I have seen you working day and night just out. I have no clue how you have done it, but what was your motivation?
I think my motive, like what you just said, you first you were reading about things happening in other areas, in other countries, in New York. And yes, it was troubling. But when I heard of one of my, friends getting exposed and then being tested again and again for COVID and still having to go back and other things happening, you have to go on leave without pay because the outpatient clinic is closed or because you got exposed, different things. And it was like, this can't let us down. We have to do something. And okay, I cannot solve the entire problem for the rest of the world, but if someone I know goes through this and doesn't have, that was my motivation. Gotta, whatever I can do with this team to help the people, at least the people that are near me and I can help them, I will do in the time that I have.
That is so true. And I think in 3 days, we raised enough money for us to buy as many N95 that was needed by our 250 female physicians in Bay Area. We were able to get some of them already, and we are on our way to getting more. We do need more donations, and we are working on that as well.
I've mentioned to you, give me the verification of the number of physicians and I'll be there for you guys.
Thank you so much, Dr. Gaurav. I will add just one more challenge or two more challenges that I have had in this whole process. There are so many people and community people who are actually giving all these donations to hospitals, to clinics, and every time they will ask us this question. Every time a person reaches me out and asks me, are you really gonna give it to a physician? Why aren't you guys getting it from the hospital? As easy as it is said, and I wish I knew the answer, what I can say is the hospitals probably are rationing it for those people who they think is very important and are facing the COVID positive patients and for procedures and things like that. But for us, I think it does matter because I do feel all the hospitalists and all the internists and all the ER physicians and urgent care nursing home who are seeing these COVID suspected patients as well, they are almost equally at risk. And no $5 N95 mask is worth a life. That's where we all got together, and everything has been amazing since that day. It is just remarkable to see a bunch of physicians, citizens just coming together to come up to this place. And thank you so much for everybody. It's just amazing to see everybody getting together and doing this. Thank you.
Anita, can I just tell you a small story? So I was donated. So somebody came over to my house and donated, I don't know, probably 20 masks, 20 N95s. And so I didn't need them because I closed my clinic, but I shared them with the pulmonologist who shares office space in the same complex. So he hadn't had any N95s. And so he took the N95 and he called me that evening and he said, I'm so grateful that you brought this N95 by, because I wore that N95 to then to see the next patient that I saw. And it turns out that lady had tested for COVID, didn't tell me, and then tested positive the next day when the test came back. And she had just come in for routine follow-up. And so had he not had an N95 mask, he would have been in quarantine. And he's a pulmonologist in our ICU. Mm-hmm. So, we talk about minutes mattering. Like if I hadn't walked in at 10 o'clock in the morning and handed him a mask,
or worse,
what were the chances of that? Right? I mean, I got up in the morning and I got the mask to him as soon as I got it.
Yep.
There's a real disconnect, I feel, but I mean, everybody knows it's obvious between the CDC guidelines and and what's happening in the front line. I mean, you know, it's a total disconnect. You know,
You know, if
we
you
tell
speak
there's
about
social
guidelines,
distancing, we're telling people to wear masks, but yet we're not providing that PPE to the doctors who are seeing these patients. We know they're asymptomatic carriers. We're telling them to stay home. The only people who are coming to the hospitals to visit, there's a very high chance they're COVID positive. You know, everybody who's seeing a patient should have a PPE. Bottom line, we're in the United States of America. Why not?
okay. The worst still is that somebody has a PPE and is not allowed to use it.
And that's happening with some of our physician friends as well. I do know, yeah, if they want to double protect themselves and they are wearing bunny suits, even that kind of, they are not allowed. Because I mean, yes, it makes, like, you know, one physician is wearing a complete bunny suit, even though if he or she has bought it, and the other physicians are not, there is a discrepancy, but every person has the right to protect themselves in whatever best way they think. So it's just
Not just
something
that,
that I
you know,
cannot
it's
understand.
one less host for the virus. Let's do it.
It
Exactly.
shouldn't even be a question.
It's also, they are being vectors. These physicians who are taking the COVID from one patient of theirs, traveling it to their family, to the patients, they are all vectors. We are all acting as vectors. We need to stop it whatever way we can. Threatening hospitals, trying to tell us that that's not the right thing, because CDC suddenly decides that, okay, bandana are the way to go, not mask. How can we justify that? Like, it doesn't even make common sense to us. If they are firing physicians, if they are threatening physicians who are going to ICU seeing these patients, it just doesn't make sense. But we can only do what we can do. We are doing our part, and I thank you everybody for participating and doing your part. Thank you, really appreciate it. And I'm gonna clap right now, and please join everybody. Please, I'm gonna unmute. I just want to clap. Everybody should clap. And thank you so much, everybody. Thank you. Really appreciate it. All that you guys are doing.
Thank you. Thank you, Anita.
I'm
Thank you,
gonna end
Anita.
this meeting.
Great
Such
going,
a
guys.
great meeting. Thank you all.
We just
Good
reach
job,
out.
guys.
Reach out.
Yeah. Take care.
Thanks,
Have
Anita.
any, right.
See you later.
Californians.
Bye.